This week's presentation is on the health aspects of the aging. The aging population. According to the U.S. Census report, the number of Americans aged 65 and older is projected to be more than doubled by 2060, with those over 65 projected to outnumber children aged 18 and under by 2035. With this growing number, healthcare organizations are forced to rethink and consider different requirements and approaches to long-term care and healthcare in general. Of course, as caring for the elderly will soon take up a bigger portion of healthcare than caring for the health needs of the young, it is important to consider factors such as nursing home, continued care, and many other different factors. To effective to effectively see the future for the aging population, healthcare leaders need to be innovative, creative, and open in how they treat the aging population. Major issues that will count to affect the aging populations will be lack of um, savings in terms of government spending, federal spending, and long-term care, and a fragmented and institutionally dependent delivery system will also pose significant risk to the health and quality of life of aging Americans. Our healthcare workforce will need to be retooled to manage the multiple chronic conditions which are very prevalent in this vulnerable population. Care needs among the U.S. aging population are, of course, changing rapidly, and aging Americans will experience increasingly severe and also complex health conditions. It is reported by the U.S. Census report that almost half of the U.S. population is expected to have at least one chronic disease by 2030, and over 40% of the 65 plus population by 2040 are likely to have diabetes. Nearly 80% will experience hypertension. The number of Asian individuals with three or more chronic conditions has also increased significantly within the last 10 years, and this is expected to grow to 40% among the 65 and over population by 2030. As reported, care needs are rapidly changing for the elderly. Um, um, The aging the aging face major problems, but with the help of policies, it can improve the cost, of course, and quality of healthcare for the aging population. Two major topics in terms of providing and better care are patient self-care and also self-management. Self-management and also the constant debate on health policy, which is widely, believed that the aging of the U.S. population is a major driver of the annual growth in the demand for healthcare and maintaining health spending. Although estimates vary, older adults do account for a substantial proportion of hospital days, ambulatory adult primary care visits, home care visits, and also nursing home residents. Over the next 30 years, as the number of older Americans double, almost every medical specialty will have an increasingly older patient base. And as a result of this, society will, of course, face critical challenges regarding health and also social services. Um, Politicians are currently confronting and a big range of specific challenges in healthcare for the aging, which this can include Medicare payment reform, contributions to the Affordable Care Act, improving quality through financial incentives, of course, like Medicare's value-based purchasing initiative, the role that states play in health policy, and also reauthorizing the Older Americans Act. And another one that's very important, of course, is strategies for chronic care coordination. Policymakers can improve the outlook for the future, of course, by reducing current gaps. And these gaps are perceived in, of course, education, employment, and financial responsibilities. And that is just goes for policymakers, tax dollars, and the older population.